Hi, so today I'm going to be talking about the breakdown as of September 2025 of what it takes international medical graduates, that's the IMGs, to become licensed to practice in Manitoba, Canada, based on the latest requirements as of September 2025. So whenever you are watching this, know that this video was done with the requirement as of September 2025 because things change and you need to know this. So peradventure anything changes and I have the time as at that time, I will still bring it up here. But know that as of September 2025, this is what is obtainable for international medical graduates to become licensed to practice in Manitoba, Canada. So, and that brings me to say, if this is the first time you're coming to my channel, please subscribe, share, like, and make sure you take this video and send it to any medical doctor or dental doctor that you know that is in your timeline, or you know that is in your contact that might need this, because sometimes there are no information out there for doctors to know what to do for them to practice in any of these first world countries, especially Canada, that have different provinces with different requirements. I hope you should be kind enough, or you will be kind enough to send this to any of your friends that are doctors. So that brings me to say regulatory body and foundational steps. On this regulatory body and foundational step, the thing is this: the College of Physicians and Surgeons of Manitoba is the provincial regulatory authority responsible for granting medical licensure in Manitoba. Then IMGs must hold a medical degree from a school recognized by World Director of Medical Schools. You can check if your own school is in the World Director of Medical Schools. Then you will get the licensure of the Medical Council of what? Canada, by verifying your documents. So you submit all your required documents on the Physicians Apply website. Then you do what? You write the required successful completion of a MCCQE Part I. Then you do every other document verification or exam that requires you to get what? LMCC, for you to practice what? In Manitoba. So it is left for you to open an account with Physicians Apply. There is a video I did on how you can do that, so check out for that video. It pops up before the end of this video. Check out for that video, and it will take you through the step-by-step of how you can open your own account with Physicians Apply and do what? Verify your documents. Let it be said, okay, that this your medical document or medical certificate can now be likened with that of what? Medical certificate in Canada. It is after that stage you can now begin to think of MCCQE1, MCCQE2, that's the NACOS key. So you have to pass through document verification first. And how can you do that? Go to Physicians Apply website, upload your documents, wait for them to verify it. And by the time they are done verification, you will now know where you stand to start your application to practice in Manitoba. Then there are pathways to practice in Manitoba. So the thing is this: Manitoba has 4 main licensure pathways for international medical graduates. I'm sure you don't know this. 4 main licensure pathways, and I'm going to take time to do what? To address it one by one so that you will know where you fall in, or the one you can leverage to come into Canada to practice in Manitoba. It is going to be divided into A, B, C, D, and I'm going to explain each of them. For the A, medical licensure program for international medical graduates, which is what? The MLP PIMG, medical licensure program for international medical graduates. Let me explain this. This medical licensure program for international medical graduates, it is a 1-year training program designed for family physicians, especially for the family physicians that are ready to practice what? In rural or underserved areas of Manitoba. Eligibility is this: you must have what? MD or DO or MBBS or MBCH, whichever one your country is giving, from a recognized institution that Canada recognizes. And when Physicians Apply verify it, it will be what is what? Verifiable. minimum 1 year of postgraduate clinical training in family medicine. Then you meet the College of Physicians and Surgeons of Manitoba English language requirement. There is a video I did on what English language requirements. It is still going to pop up. You will see it. Then you will know whether you are going to get a waiver for English language requirement, or you're going to do what? Write IELTS, CELP, OET, or any other one I listed in that video. But one thing is this: upon acceptance into this program, which is a 1 year program, if you're in Canada and you're an international medical graduate and you are wondering how to join medical practice in Manitoba, or you are in another province and you want to practice in Manitoba, this is an opportunity you can leverage. It is just a 1 year training. So upon acceptance in this program, the College of Physicians and Surgeons of Manitoba registers you, that's the applicant, as a regulated associate member. They call it educational resident class for the training year. For that training year, that when they say, okay, this is the training year we are accepting, there is always a deadline. So make sure when you are applying, you meet the deadline. Then after completion, physicians apply for provincial registration. That's what I said. After your completion of physicians apply, family practice limited, and enter a return of service. So after you have gone through this training, you can now enter for a return of service agreement in the underserved region with mentorship from the University of Manitoba. So you will go through this. It's just like a mentorship program. Then when you do it, there is a return of service that you will serve in the underserved area. This is something you can leverage if you are new in Canada. Remember, as a family physician, if you are practicing in your home country as a general practitioner, so general practitioner is also the same thing as a family physician, but make sure you have a minimum of 1 year. If you have 2 years, fantastic for you to apply for this route. Then some country call it medical officer. So if you're a medical officer, which is some country called family physician, some country called general practitioner, the only thing is be able to prove that you have done rotations in the required department, which is in one of the videos I've already posted on the step-by-step on how you can do practice in Canada. You can go through that video to see where you fall in. Then the pathway B, which is the practice ready assessment pathway for family practice. It is a 3 to 4 month accelerated assessment for international medical graduates already considered practice ready in family medicine. So you must have an MD, DO, MBBS, MBCH. Don't worry about the fact that I didn't put MBBS or MBCH. Just know that they are all included. Then at least 2 years of accredited postgraduate family medicine training or 1 year training plus 3 years of practice within the last 5 years. So the thing is this: you should not have been out of practice for up to 2 years. So if you are just in your home country and you want to apply for this, you can actually do apply for it immediately you enter Canada. That means you will not have stayed off work for up to a year. So, and you have to do pass the NACOSCI or MCCQE Part 2. So do you understand? So sometimes they call a NACOSCI or they call it MCCQE Part 2. Used to be MCCQE Part 2 used to be the previous name, but now it's called NACOSCI. So it offers a fast track to provincial licensure in underserved area. So if you're doing the PRA pathway, family practice pathway, know that you are doing this because they want to do fast track you to start practice in the underserved area. Then the C1 is practice ready assessment specialty practice. So if you are a specialist back in your country, for specialists trained abroad who are eligible to practice independently in their field, whatever field that you know, whether you're a radiologist, gynecologist, obstetrician, whatever, this pathway is what you can also leverage. If you can prove you are now a specialist, then completion of recognized specialist postgraduate training, employer or regional health authority sponsorship required So you will need to go to Manitoba and try to see, okay, if there's any of this regional health that want to employ you as a specialist, whether you're a cardiothoracic surgeon, whether you're a gastroenterologist, let there be an employer or regional health authority sponsorship that want to employ you as a specialist. So that's a practice ready assessment specialty pathway. Then the D aspect is what? Matching via camps to residency. You can see in this specialist pathway, did you see me mention any exam? Okay, so that you will do what? Understand that, okay, if you're already a specialist, you should be able to prove that you are what? A specialist for you to go through this pathway. Then D1 is what? Matching via camps to residency, which is the one you will write your MCCQE and write NACOS key. Then you do what? You will now wait and apply. But one beautiful thing about matching via camps to residency is this: you may have been out of practice for up to 3, 4 years, 5 years, and you can still do this one. That's a match through camps. That's why you see a lot of people that have been in Canada for 5 years, all of a sudden they will tell you, oh, I've matched. Most of them are going through this residency pathway. They're not going directly to practice ready, because practice ready requires recency of practice for you to do that. So IMGs can apply for entry into Canadian residency programs in Manitoba via camps. Requires document verification through physiciansapply.ca, followed by orientation programs upon match at camps.manitoba.stats.com. Then this route leads to full licensure through standard postgraduate training and certification. So it's just like you going through residency in your home country. That's just going through residency in Canada. And this is how you can do what? Practice in Manitoba. These are what the 4 major pathways to practice in Manitoba. If you have any questions, you can drop it in the comment and I will answer. So general prerequisite across pathways. For all pathways, there is what? Document verification. And you can do this document verification on physiciansapply.ca, which is the website I have told you to go to and upload all your documents for verification. Language proficiency. Demonstrate adequate English or French skills as required by the College of Physicians and Surgeons of Manitoba standard. So make sure you meet the standard. There's a video I did on English language proficiency and how you can get a waiver if you want a waiver, provided you can demonstrate that you are qualified for the waiver. Go through that video. It will pop up before the end of this video. Then you will see it. You can click on it and go through it. Then meet the exam requirements. Apply for PRA or PMLP-IMG only after clearing necessary MCC exams like NACOS key and what MCCQE amongst what others. Make sure you meet requirements before you apply for any of the A to D pathways, because the rule will not change for you, the law will not change for you, except there has been an agreement that the law will be changed. It cannot be changed for one person. It will not make it it will not be something that even you will be happy if it happens to another person. So make sure you meet the required what? Exam verification, the required document verification. In fact, have more than enough to prove that, okay, you are qualified for this position. I hope that helps you now. So that is for the general prerequisite for other pathways, as in across pathways. So here I have the requirements for the different pathways and in a tabulated form so that you understand it. These are the pathways. I need to highlight it. So these are the pathways: MLP-IMG, then PRA MB, family practice, PRA MB specialist pathway, CAMS match. So these are the duration. This one takes 1 year, 3 to 4 months, 3 to 12 months, 1 to 5 years residency. Then focus is what? Family medicine, specialty practice, any specialty that you want to go in for. This is where CAMS comes in. Where I talked about, you can come for residency in any department that you want to go into. Then key eligibility is what? MD, DO, MBBS, MBCH plus 1 year postgraduate work, then plus English language proficiency plus LMCC certificate or licensure. The MD greater than or equal to 2 years training or 1 or plus 3 years practice plus what? Exam. MD, DO, MBBS, MBCH specialist training plus sponsorship for you. Let there be somebody saying, okay, let this person come and work with us. Then this one is what? MD plus match plus orientation. Outcome is what? Provisional licensure after program plus service mentorship. So after you go through this program, they will give you provisional licensure. Then you will go to where they posted you in the rural area to practice, and you will be there under mentorship. Then you have accelerated licensure plus what? It's your service. You will start working for them. Assessment towards licensure in that specialty that you said you are qualified to practice. Then this one is what? Full residency certification and what? Licensure. And this is one thing that many people may say, oh, how long is it going to take? You have to be prepared to go through residency, because even back in some of our countries, residency still takes that kind of 5 to 6 years in some countries as well. So it's not something that if you really put your mind to do it, it shouldn't deter you. You can do it, and that's it. Then what's next? Next steps and recommendation. 1, determine which track fits your background. You know your background more than I know it. Determine which one that fits your background well and go for it. That is it. So that you don't start something that you cannot finish. So family practice or specialist pathway, which one do you think fits you best? Considering your practice experience, the exams you've passed in your home country, and what you have done in your home country. So this is one of the eligibilities that could what? Help you. Then ensure completion and documentation of required exams. MCCQE, NACOS, whichever one that you fit into, make sure that you do what? You meet up with it. Then submit verifiable documents, fair physicians apply, and keep sharing permissions active for College of Physicians of Surgeons of Manitoba. The thing is this, you can't play hanky-panky with Canada medical practice. That's one thing I want to tell you. You can't even play hanky-panky with it. Make sure that all documents you are submitting are verifiable. Verifiable. If you say you have practiced in English language for years, let the whatever letter you are getting be verifiable. Wherever it's coming from, whichever country, let it be verified. Whatever you say you have done should be what? Verifiable. Then what is it for you there is what? Apply before upcoming deadline and secure sponsorship if you're going for the PRA specialist pathway. Please don't go and be applying one day to deadline. Does it? Yes, you will say, okay, it's still within the confines of it. But the truth is what? What if there are things that you need to do that, and by the time you're submitting, you see, oh, there is this thing I did not do. You will not even have time again to rectify it, because the deadline is already there with you, and you are applying one day to deadline. So please make sure you apply before the deadline. Then prepare for English language testing should you not meet the criteria for a waiver. So I made a video on how you can get a waiver. Go through that video then, so that you will now see you will see if you meet what? The criteria for a waiver. And understand the return of service commitment if you're signing for PRA specialist pathway, or you are using any other sponsorship pathway. Please stay to your commitment and understand return of service commitment. Understand everything that is in your contract, so that you don't become a deviant. If accepted into MLP, IMG, or PRA, these are the ones where the return of service commitment is very, very important. Make sure you meet the standard or the requirement for this. I hope this helps someone. If it does, congratulations if you're applying for this. And if you need any help or you're confused about any of the things I've said, drop it in the comment section. I will respond to it. And my email is there. If you think you need anything that require more explanation, you can email me and I will respond to you. Having said this, Please send this video to at least 2-3 of your doctor friends that you know would want to practice in Canada. If you are able to do this, it means you're going to be giving people opportunity to do what? To live their vision. And if you achieve it for someone, I'm sure that the person will not forget you in a hurry. And having said this, please remember to share, like, comment, and what? Drop any of the topics you think you want me to talk about. I will go and work on it and bring it to your notice. Having said this, bye and have a nice day for today.